There's more to just getting a massage and feeling good and feeling loose. There's something about having muscle lengthen, having muscle not spasm and tug on joints and cause pain. Not all of us can afford going to a massage therapist that often. I suggest once a month, especially with history of fibromyalgia, chronic neck pain, headaches, if you work at a keyboard for more than 40 hours a week. And if you can't afford a massage therapist, insurance sometimes will pay for chiropractic care, and the hands-on healing of chiropractic care is also just as good. But a patient came in to see me with fibromyalgia yesterday, and she brought in her own Theracane. And I had suggested she purchase one. This is a Theracane. It's an S-shaped plastic cane that has knobs on the end. I picked one of these up about 10 to 12 years ago when I went to a physical therapy office to see what they were doing with my patients, and there was an excellent opportunity to see this in use. A patient of mine was sent to physical therapy for some problems with the shoulder girdle, back pain, but the therapist had used the Theracane in her own way to help the muscle relax. The patient was in too much spasm to participate in some of the exercises that the physical therapist was trying to show, so she used the Theracane to put direct pressure on muscle, and I actually watched the muscle lengthen, shorten, or get rid of the shortened ends, and the posture improved immediately so that the patient could take full advantage of the exercises she was being taught. The basic premise of this is to apply direct pressure, and there is some discomfort, but apply direct pressure to the center muscle belly of a muscle group. A muscle has an origination point and an insertion point. That's all muscles. The long muscles are easy to figure. Trapezius muscles on the back are kind of broad, but they all have origination and insertion. In between those 2 points is where you'll see, usually about the middle, the biggest thickness of muscle. Through the work of Travel back in the 60s, we found that certain symptoms of discomfort in the chest, shortness of breath, headache, could be related to muscle spasm and what's called a trigger point. And this is beautiful in acupuncture. Using a needle to relax a trigger point, you'll usually see muscle spasm and pain just melt away. You can do that with any kind of pressure point application, Theracane, or the old way is taking a tennis ball, putting it against the point on the back that's painful and leaning against the wall and applying some direct pressure for a short amount of time. My analogy to my patient yesterday was, think about what happens when you have a charley horse or a spasm to the calf muscle middle of the night. Usually the muscle will shorten, it'll pull on the area behind the knee and on the Achilles, and it'll cause pain. Until you stretch the muscle out, massage the muscle, or just wait, and then the muscle just relaxes and pain stops. You can speed that along again by hitting the muscle in the right position so that it essentially overwhelms the muscle into contracting further and then relaxing. All muscles will usually fatigue after a while. Just like running, if you try to push the envelope past the point of when you hit the wall, as it's called, your muscle will start to fatigue and it won't work anymore. And that's the concept with spasm, especially trapezius muscle spasm. If you overstimulate it with direct pressure for about 30 seconds, continuous, not so painful, but a little bit irritating. The theory is after you let go of the pressure, the muscle will loosen a little bit. The pain will stop for a short amount of time. But that window of time of being pain-free is when you can either take advantage of rehab exercises or just take advantage of being pain-free with no headache. Stretching, applying things like essential oils or Trameal or an ice pack that would work to keep the spasm from coming back. So the ideal is in the area of the trapezius muscle, apply this, try to find the area that's most spastic or painful. Once you find an area that can cause your pain to come out, try to apply some downward force. So you're applying force in this direction with this specific Theracane. And it's easy access. You don't have to be that muscular or strong. Just apply downward force to the point where you'll feel the discomfort without putting yourself into severe pain, and you hold. Some cases when you have a trigger point, when you find that trigger point, you'll actually refer pain up into the head, into the back of the eye, down into the low back or into the arm. That's when you know that trigger point is correct. And when you apply enough pressure to the trigger point, taking some slow deep breaths in and out while maintaining the pressure, the ideal would be eventually either the pain decreases or you feel a little bit more loose. So those are the objectives with trigger point spasm and the use of the Theracane.